My child has a fever. What should I do?
Well, that's a question we are exposed to in the pharmacy every day.
First thing first, how to measure fever and when to call it a fever.
What to do, when to start to treat it, when to see medical help or even call the emergency services.
What is the right temperature and what to do in case of emergency.
These are the keywords for today's video. I'm Henry.
I'm Wasim, and we are both certified pharmacists in Germany. Fever is simply a rise in body temperature above the normal. Normal oral temperature is 37 degrees Celsius plus minus 1 degree. Also, rectal temperature is about 0.5 degree higher than the underarm temperature, which, like the underarm temperature, is actually lower than the oral temperature by also 0.5 degree.
Yeah, parents should seek medical advice if their child is younger than 3 months and has a rectal temperature of 38 or higher.
For older children, if they have a fever lasting more than a few days, or if they are showing signs of dehydration or difficulty breathing, it's essential to consult a medical professional.
Yeah, and during the course of 24 hours, there can be fluctuations in the temperature. Fever is often classified as being mild, like up to 39 degrees, or high, which is above 39 degrees.
Those younger than 5 years old, the best temperature to take is the underarm using the electronic or chemical dot thermometer.
Infrared tympanic thermometers are also advocated. Forehead strip thermometers, which actually touch the forehead, are easy to use, but should be avoided because they are unreliable. So, it's essential to remember that fever itself is not a disease, but rather a symptom of an underlying condition. In most cases, the cause is an infection, and it's just like the body's natural response.
In fact, fever is one of the most common reasons parents take children to see the doctor or seek medical advice.
So, let's talk about some tips. There's a lot to do when your kid has a fever. Firstly, for example, put a cool compress on their heads, or you can also give them a lukewarm sponge bath. Secondly, keep the room at a moderate temperature. Not too hot, not too cold. Thirdly, dress them in one layer of light clothing and offer a light blanket. Fourthly, make sure they drink a lot of fluids, so stay hydrated.
Always remember 3CD: cool body, controlled temperature, cotton clothes, drink liquids.
If your kid is having fever for more than 1 day, it is recommended to start measuring and recording the measured fever. Simply use a piece of paper, as shown here, and put the time, the fever measuring method, for example rectal, and the measured fever. In the daytime, if your kid is active, like playing and eating, you should take the fever every 4 hours. But if you feel that your kid is not that active, like sleepy or a bit tired, measure the fever every 2 hours.
In nighttime, you should expect that the fever will rise between 9 to 12 p.m. And when your kid is sleeping, you should measure the fever every 2 hours.
Wasim, how can parents manage fever at home?
Well, there's a few steps that you can take with your child to get him or her feel more comfortable. First and foremost, it's essential to ensure that they are getting plenty of rest and stay hydrated.
Right, and over-the-counter medications like Paracetamol and Ibuprofen can be helpful in reducing fever and relieving discomfort.
However, it's essential to follow the correct dosage, instruction, and consult medical professional if you are unsure about dosages of those treatments.
For example, Paracetamol. For children, we have syrups and suppositories, which you can give 10 to 15 milligrams per kilogram orally every 4 to 6 hours as needed, not to exceed 5 doses in 24 hours. Paracetamol has no commonly occurring side effects, does not interact with any medication, and so can be safely taken by all children.
Ibuprofen, on the other hand, 6 months to 2 years old children, they can take 5 milligrams per kilogram for temperatures lower than 39 degrees, or 10 milligrams per kilogram for temperatures above or equal to 39 degrees. 1 to 12 years old children, they can take 5 to 10 milligrams per kilogram orally every 6 to 8 hours as needed. Maximum dosage is 40 milligrams per kilogram per day or 4 dosage per day. Ibuprofen can cause gastrointestinal side effects such as nausea or diarrhea. It also interacts with many other medications. Also, those medications is not usually, or it's unlikely to be taken by children.
Here are some facts. Paracetamol and ibuprofen start to reduce the fever between 30 to 60 minutes after taken, and the effect of paracetamol stays up to 4 hours, whereas the effect of ibuprofen stays a little longer for up to 5 hours.
If you want your child to have an extra 2.5 hours free of fever, especially at nighttime, we recommend to consider giving paracetamol plus ibuprofen in recommended dosage.
Also, all dosage times are carefully recorded to avoid accidentally exceeding the maximum recommended dose.
Always remember, paracetamol every 6 hours, ibuprofen is every 8 hours, in combination in a cycle of 6 and 8 hours.
Watch out. Never give your child, which is under 12 years old, aspirin.
You should seek medical attention if your child less than 6 months old and the temperature above 39 degrees and persist after giving anti-fever treatment, or if your child is between 6 months and 12 years old and the temperature rises above 30 degrees and persists after giving anti-fever treatment. So, you should also call 112, the German emergency services, if your child getting the following symptoms: unresponsive, wheezing or difficulty breathing, blue lips,
Convulsions or seizures, speaking in a confused way, a fever with a stiff neck or a headache, and temperatures higher than 40.5 degrees.
fever with sudden onset of rash, severe stomach pain or persist vomiting, skin rash, blisters or red stick on arm or leg, severe sore throat, swelling of the throat or earache, pain with urination, back pain or shaking heels, severe cough or coughing up blood. Those are all the symptoms that you should consider to call the 112 if your child have one or two of those symptoms together. And you just keep doing the tips that we give to you, the 3CD principle, and giving the treatment until the help comes.
We hope we could give you a good overview about fever treatment and symptoms to be cautious about. See you in the next video.
Bye-bye.